My name is Michelle Trotter, and I'm a business development specialist here at Eagle. Every week, our experts are committed to providing you with scientific and accurate information about the coronavirus to help you feel at ease and educated during this pandemic. We received a couple questions this week, and we have Dr. David Hussong here to answer them for you. One question that was asked from a concerned citizen in Austin, Texas. Starting in late March and continuing through early fall, Austin has one of the largest urban bat populations. Since I live in Austin, Texas, do I need to be concerned with the bats carrying the coronavirus? We also have mosquitoes during the summer months. Should I be concerned with them or any other flying animals carrying the coronavirus?
Question has come in from Austin, Texas concerning risks of coronavirus infection because the bat population is very high down there. There's a risk of viruses from bats, and some of the viruses might include, for example, rabies. And since the coronavirus was apparently originating from bats, there would be a problem if you were very close to a bat and tried to touch it and perhaps let it bite you. So we generally recommend that when you see bats that you stay away from them. That would be a general rule. I would not say that there's a risk due to a bat flying way in the air, but you have to be aware of that sort of thing. Risk comes when you have contact with a bat. We do not want that. We also had a question about whether mosquitoes posed a risk for transmission of the coronavirus. There is no evidence yet that this is a mosquito-borne or otherwise insect-borne virus. Insects, like mosquitoes, are known to transmit encephalitis, such things as West Nile fever. So you definitely want some insect repellent and just be careful about what you're doing. Be aware of it. There are certain times of day when mosquito populations get greater, so try to minimize contact with mosquitoes.
Second question. By the time that people are no longer getting sick with the coronavirus, will there be over 50 different strains of the COVID-19?
The question really sounds like how bad the spread of the diversity of these viruses will be by the time this is over. This particular outbreak is just the start of a change in coronavirus. For the last 50 years, coronavirus has been studied. In the past, it's been regarded as a less critical medical issue. This novel strain that has come out is a different one, and it has now gotten into the public, and it's being distributed by modern transportation like airplanes. This will not be over. This will be recurring, much like flu comes back each year. The number of strains will increase at a rate that can be tracked. There are some sites show the number of strains as they emerge and diversify. The major strains, just like flu, will have a primary encoding, and then the minor strains will branch out. Whether we have 50 or 100 by the end of this year's infection cycle is unclear. I think somewhere around 4 or 5 major strains, and each one probably has about 10 more substrains. So the exact number cannot be put into a fixed number. We will have quite a few, and they will emerge over time.
Last question. If herd immunity was better than a vaccine, should I try to expose myself to the COVID-19 virus? Developing a natural immunity toward the disease is better because it triggers your immune system to make antibodies against the germ causing the infection.
The question asked was based on the premise that herd immunity from a natural infection is more effective than the immunity conferred by a vaccine. We don't have a vaccine yet, but that's being developed. Each year, we try to develop a vaccine for the influenza viruses that will emerge. And some years we get it right, some years we miss. Last fall, I was injected with a quadrivalent flu vaccine, and it managed to cover most of the flu strains that are out there. However, with coronavirus, We're looking at a novel strain that seems to be more virulent than the ones that have been around in the past. Herd immunity is better, but when you get a natural infection, you risk all of the secondary effects, which a vaccine will not impart. It's better to protect yourself from natural infection as best as possible. The infections that come from coronavirus create problems with blood clots, stroke, permanent lung damage, and other issues that can be very severe. And we're seeing a much greater lethality rate among certain people. If you get a natural infection, you are at risk to other people. You may have some protection if you survive. You may also infect a lot of other people because you don't know when you're shedding. So it's not recommended, just as it's not recommended to have measles parties, which used to be popular, and secondary effects oftentimes are more severe. Vaccines generally are released with a very low secondary complication rate. They're not considered safe unless they're acceptable risk. The infection does not have an acceptable risk rate unless you're under about 30. My recommendation would be not to seek out someone to be infected from.
Thank you, Dr. Hussong. You can find the latest updates about the coronavirus and also earlier episodes of Eagle TV on our website at www.eagleanalytical.com/COVID-19. That's also where you can submit any questions that you might have for our scientific experts.